everyone. Welcome back to Nurse D 101. It's good to have you back again. I'm going to do a video today, and today is going to be just about nursing homes. Why I think that a new nurse that just graduated should start in a nursing home. Now, I know some of you are saying, well, I was a CNA and I done worked in a nursing home and I'm not going back to no nursing home working. But being a CNA in a nursing home and being a nurse in a nursing home is different, okay? CNAs, you empty the bedpans, you make the beds, you fix the, you get the clients ready in the morning, prepare everything for them, you feed them lunch and all that stuff. Not saying that you won't do it as a nurse, because you're going to still do the same thing as a nurse. But the reason why you should go back to a nursing home, whether you was in a nursing home as a CNA or just a new graduate and never worked in a nursing home at all. A nurse, when you work in a nursing home, you are going, it's more, how could I say it? It's more laid back. You have nurses there that's going to work with you. When you get into the hospital, it's a whole new world out there for a hospital. But in a nursing home, you have somebody that's going to take patients with you and that's going to show you what is going on, okay? You're going to be able to learn how to actually give medications, insulin, and believe it, there's a whole lot of narcotics in the nursing home also, okay? So you'll get familiar with the narcotics. You'll get familiar with how to the GJs, because a lot of patients in there have GJs. It has to be fed, be tube fed. You'll be able to give insulin. You'll be able to draw up medication. And believe it or not, there's a lot of doctors, there's house doctors in the nursing homes. They will even help you. I remember when I first started in a nursing home as a nurse, we had a house doctor. His name was Dr. Briggs. And he would come in there, he said, well, Dee, what hall do you have? And I said, well, I have the 200 hall. He said, well, I'm getting ready to give Mrs. Jones such and such and such. Come with me. He'll take me into the medication room. He said, now I'm going to show you how to do this. And he would take his time and show me how to actually mix that medication and pull it up and all that stuff. That's how I learned a lot, because even the doctors would show you how to do that. The nurses took their time with me in a nursing home. When you actually get into a hospital, I'm not saying they're not going to help you, but it's fast-paced. That's why I'm saying you need to start in a nursing home so you would have the lowdown, get familiar with a lot of the medications, get familiar how to give injections, how to draw blood, how to start an IV. Because when you get into the nursing home and you're going to say, well, I need somebody to help me do this here, they're going to say, well, you're not ready, you're not prepared, because they don't have the time. They might orientate you, and you follow a nurse maybe 6 weeks. After 6 weeks, you're on your own. You are on your own. And I have seen a lot of nurses, RNs and LPNs, crying on the floor, crying because they're overwhelmed. Not only are you have your patients to take care of, you have your team, you might have 5 or 6 patients there that you have to take care of. You also have to discharge that patient. And you also have to admit a patient. And they come back to back to back to back. And plus you don't forget the medications that you got for the other patients there. And the other nurses are going through the same thing that you're going through. So you can't stop over here and run over there and tell them I need some help discharging this patient, because they're discharging somebody. So this is what I'm telling you. I'm not saying that you have to start in a nursing home. That I think you should. But if you want to go on to the hospital, go right ahead. Wherever else you want to go. But me personally, I think it's a good idea to start in a nursing home. And let me tell you what happened to me the first time I started in a nursing home. I did my rounds with this nurse. She was a good nurse. She took me up and down and everything, showed me how to do everything, pulling up insulin, giving out this and giving out that. Now I'm on my own, okay? Now I had no problem actually giving up on, giving out my medications and all that stuff. But I'm gonna tell you, I was going down the hallway, and I'm looking in the patient's room, making sure everything was okay. And I happened to go in one of the patient's room, and when I went into the patient's room, lo and behold, the patient was dead. I come running out that room like a bat out of hell. And I started screaming, I need a nurse! I need a nurse! And I was yelling down at the nurse's station. I need a nurse down here. Y'all need to come down here. I need a nurse. Well, it's about 5 nurses up there. They're looking down at me like, I said, I need a nurse. They're looking at me. I said, somebody, I need a nurse down here in room 211, please. All of a sudden they got together and they said, you are a nurse. I happened to look down at my white uniform and here I was a nurse. I had forgot all about being a nurse. I went back into room 211. I got on the intercom. I said, could somebody please come down here in 211? Here about 3 of them come down. They said, what is it, D? I said, this patient is dead. And I was about ready to fall on the bed next to her. I said, my nerves was all tore up. I was shaking. I said, the lady's dead. The lady's dead. The lady's dead. They said, we gonna handle it. Just be okay. Be okay. And they showed we took everything. We had to call the doctor, give him the time that we actually found the patient dead over there. Then we had to call the undertaker. And doing that, we had to make sure all the patients was in their rooms. If they was in the dining room, we closed off the dining room and all this kind of stuff. We had to actually pronounce that patient dead once the doctor gave us an order. But what I'm saying is this. Now, what if I had actually been started off in a hospital and I actually walked into that hospital and somebody's dead and I come running out like that? Well, you know, I would have been fired. But what they did in the nursing home, to them it was a running joke. They laughed about it. I laughed about it. And they would say to me, D, tell us what happened again. D, tell us what happened again. You know, and it just went on like that there because they're like that. They're laid back. You know what I'm saying? I worked in nursing home for a year, 1 whole year. And then I decided to go to the hospital. And it was a whole new different story. A whole new different story. Talking about nursing homes, I'm probably going to have a part. This is a part 1 and a part 2 that's going to follow. But I really do think if you are a new nurse and you really want to know how to take care of patients, and this is the first time you've never been in a nursing home before or whatever like that, or you've been there but you was a CNA, try it. And let me tell you something else. Everyone in a nursing home is not old. No, they're not. There are young people in the nursing homes because they're in there because maybe they haven't taken care of themselves. They're on drugs. Now they're on drugs and they can't take care of themselves. I know one patient that was a drug. He was on drugs. He was a drug addict. But now he has to live in the nursing home. During the daytime, he can actually get in his wheelchair and he can actually travel and go different places if he want to. Somebody pick him up, but he comes back because he's on methadone. So we have a lot of patients like that get their narcotics. They come back to the nursing home for that. So don't think, I'm not going to a nursing home. I'm tired of working with old people. There's so many young people in the nursing home. I remember one woman I met. She was in there, she had a colostomy bag. She had to be like maybe 20-something years old. Well, you say, well, what happened to her? Well, she was with this guy, and her and the guy used to fight all the time. So now she decides she's going to leave the guy because the guy threatened to kill her. So she left. But she forgot her food stamps. Her food stamps were supposed to come on this certain day. So she goes back. So a friend tells her, don't go back. Don't worry about the food stamps. Well, I need my food stamps. I got to go back. I got to get my food stamps. She goes back to get the food stamps. And the fight broke out. He shoots her. And here she is with a colostomy bag for the rest of her life. And almost actually died over food stamps. So you see a lot of people, young people in the hospital because they're not using their minds. You know, they're out there, they're partying, they're doing what they want to do. And then when they get sick like that, their family members put them in a nursing home. So don't think that everybody's in a nursing home is old. No, it's not like that. But I still say, I think it's a very good idea to start in a nursing home. I really do. You'll know how to work with people that has to be tube fed. When I went to the hospital and I was training behind this person, you know, I had to walk behind her and train her and all this stuff, this nurse telling me all this. She didn't know how to tube feed. But I had so many of them, I knew how to do it. I said, why don't you just let it go by gravity? She said, no, you got to push it in this way. You got to pull it up and you got to push it in this way. And I just let her. Then finally she said, okay, it's your turn. This time I'm just going to follow you. She followed me. I'm giving out the medication. Got to the G2 person, the J person. I pulled up the medication, held it up, it went down just like water going down the sink. I had to teach her something. But I learned that in a nursing home because you have so many. You have so many things you could learn in a nursing home. You know how to unstop a J2. I'm not telling y'all to do this now. But I knew one nurse that walked around, she would put Coca-Cola in. She said, this is how we do it here in the nursing home. I'm not telling y'all to do that now. Okay? I'm not saying go do that. But those J2s would get stuck, they would put Coca-Cola down it. And it flushes out. But that's what I'm saying is you learn so much. You learn so much. You learn so much. But if you decide that you want to go straight to a hospital, then go right ahead. Go right ahead. Maybe you'll get on the floor with somebody who's going to take time with you. But med-surg and those places like that, they're not going to do it. You're going to be overwhelmed. And you might say, I wish I had started with Miss D. And because I had been a nurse so many times when I got into the hospital, and I saw some of the nurses over there struggling and crying, I would just go by there and I would give them my telephone number, because we carry phones. And I said, if you need me, call me. And I'm telling you, they was calling me. And I said, just give me a minute, let me get this medication. And then I would go over there to them and they said, I don't know how to do this. And I would show them how to do it and do it for them, let them know. But all nurses are not going to do that. Am I telling you I'm a superhero and I'm Wonder Woman? No, I'm not saying that. But I know someone had to show me. So I didn't mind showing somebody else. And to this day, I am so happy that I started in a nursing home. I am really happy that I started in a nursing home. You don't have to do it for a whole year. You can maybe do it for 6 months or whatever like that. Because you'll be a nurse, you can get a job. You can actually get a job. But I actually learned a lot in a nursing home. So when I did go to the hospital, I was able to stand my ground. So anyway, that's going to be the end of this video. And I'm going to come back with a second part of the video. Now this video here is the good part of nursing. I told you we were going to talk about the good, the bad, and the ugly. This is the good part. Working in a nursing home, you hope you learn a lot. And it prepares you to go forward. Anyway, I'm going to end this video. It's nice seeing you. And we'll talk again soon. Bye.